Pathway to Potential, when we first launched, the 5 pillars that we adopted were actually the same 5 pillars that the Ontario government had identified in its poverty reduction strategy. So we wanted to make sure we had a structure that reflected what was happening at the provincial level. So we had housing, childcare and early learning, education and skills training, health, and income support as our initial 5 pillars. And then we had structured our organization, our collaborative, around those pillars. So we had a roundtable, multi-sector roundtable, consistent with the Vibrant Communities model. And then we had 5 subcommittees at the time that were all dedicated to each of those 5 pillars. But what we found actually over the evolution of Pathway to Potential was that we were learning that in some of those areas we didn't necessarily need to be developing a new committee or a working group. And so we really started to adapt and pivot and look at what role can Pathway to Potential play in the community? Where can we have the greatest impact? Because, you know, as many of you who are doing this work are aware, there's always this perception, and sometimes it's well-founded, that, you know, there are a lot of groups doing similar things and there can be a lot of overlap in a lot of areas. So we certainly didn't want to be seen as coming into the community and trying to recreate the wheel. We wanted to have the highest impact we possibly could. So the 4 pillars in front of you now reflect our 2015 through 2018 strategic priorities. And then the next slide, you'll see how our organization is structured, our collaborative is structured to reflect, I think, a more comprehensive approach. So we have a collaborative leadership team now that is actually smaller than our original roundtable. Our roundtable had upwards of 35 people, but what we were finding in the early days with our roundtable was that people were a bit confused about the decision-making structure and their role. The roundtable members weren't clear always on what their unique role was. It seemed like a lot of the work was being driven by the working groups. So after a few years into the strategy, we developed a smaller leadership team, the collaborative leadership team, and made sure that all of the chairs of each of our working groups had a seat at that table, but also others in the community had a seat as well. So right now it's 15 members, and it's worked quite well in that way because it's small enough to really make, I think, the decision-making process more effective, but it's still fairly representative. And what we also did, you'll see at the bottom of the slide, is rather than have a roundtable, we really were getting a lot of feedback that the roundtable model had limits around inclusiveness, and we didn't want it to be perceived as this, you know, group that only certain people in the community could attend, and we wanted to open it up. So we thought a good compromise would be having a much broader multi-sector network of supporting partners and volunteers, and really opening up the process to let anybody come in at any point and get involved, and really focusing on how we can help people plug in a way that makes sense for them, recognizing that not everybody wants to be involved through a monthly meeting. Some people want to be involved just by, you know, they might have space, or they might have a particular skill set that they can apply or provide. So you'll see with this structure here, we've got, you know, on your left-hand side, you've got the working groups in the blue bars that we have identified as areas needing Pathway to intervene and be involved, because there wasn't a lot of activity in those areas. Employment and training, specifically around affordable transportation, social determinants of health. We're talking really about income, and the living wage campaign has been the biggest focus right now. On the right-hand side, you'll see all of our partner groups. So these are all of the different community collaboratives and coalitions that we play a supportive role in. So that's how we message our role in the community. Some issues we play a leading role in, some we play a supportive role in, but our focus is always how do we make sure we know what is happening in the community so that we can have the most coordinated and comprehensive approach. So it's never been about Pathway needing to lead everything, and we recognize when we need to step back and just support other groups in the community that are doing really good work. So that structure has worked out really well for us. We've had that in place for a couple of years now, and I think it's more conducive to community engagement and people feeling more valued, I think, as part of our network. And so we'll see. But it's always an evolution.